Good morning, everyone, wherever you're watching from, and welcome to my new channel. I'm Dr. James Harper from the Heart Matters Educational YouTube channel, as you all know from the introduction video. Today, we're talking about one of the most critical health issues facing our world: heart disease, also known as cardiovascular disease or CVD. Heart disease refers to a range of conditions that affect the heart's structure and function. It's often linked to atherosclerosis. That's the buildup of plaque in the arteries, but it includes many other problems. While heart disease typically focuses on the heart itself, cardiovascular disease is a broader term that also covers blood vessel issues, like strokes or peripheral artery disease. These terms are often used interchangeably in public health. Tragically, CVD is the leading cause of death and disability worldwide. Section 1. Common types of heart disease. There are many types of heart diseases. First, the most prevalent, coronary heart disease, or coronary artery disease. This happens when the arteries supplying blood to the heart narrow or block due to plaque. It can cause chest pain, known as angina, or lead to heart attacks. Next, heart failure. The heart can't pump blood effectively. Often, this follows damage from a previous heart attack or other issues, leaving the muscle weakened. Then arrhythmias. These are abnormal heart rhythms. A common one is atrial fibrillation, an irregular beating that significantly raises the risk of stroke. There are also inherited or genetic conditions, like familial hypercholesterolemia, which causes very high cholesterol levels from birth and speeds up artery disease. Congenital heart defects are structural problems present at birth, such as holes in the heart walls or malformed valves. These often need lifelong management or surgery. Other types include valve diseases, where valves leak or narrow, cardiomyopathies, which are diseases of the heart muscle, and inflammatory conditions like rheumatic heart disease, often stemming from untreated infections. These conditions can strike anyone, but many are preventable. Now let's look at the numbers. They're staggering. According to the latest data from the Global Burden of Disease Study, up to 2023, the World Health Organization, and the American Heart Association's updates, cardiovascular diseases cause around 19-20 million deaths each year. That's about 1 in 3 global deaths. In recent estimates, global CVD deaths have reached nearly 20 million annually, with projections suggesting around 20.5 million in 2025, potentially rising to over 35 million by 2050 due to population growth and aging. The burden in terms of disability is huge. In 2023, CVD accounted for 437 million disability-adjusted life years, or DALYs. That's years lost to premature death and living with disability. This has increased 1.4 times since 1990. Prevalence is alarming too. Over 500 million people worldwide live with CVD, roughly 1 in 12 people. And this has doubled since the early 1990s. The leading causes within CVD: ischemic heart disease, coronary artery disease tops the list, followed by stroke, hypertensive heart disease, and others. Regionally, about 80% of CVD deaths occur in low and middle income countries, where healthcare access for prevention and treatment is often limited. While age-adjusted death rates have declined globally by around 35% since 1990, thanks to better management in some areas, the total numbers are rising fast because of aging populations. The highest burdens are in regions like Eastern Europe, Central Asia, and parts of Sub-Saharan Africa. Worryingly, risks are increasing fastest in younger people in developing countries, driven by rising obesity and diabetes. The good news? Experts estimate that about 80% of the CVD burden is due to modifiable risks, things we can change. Top factors include high blood pressure, unhealthy diets, high cholesterol, air pollution, smoking, obesity, and diabetes. Behavioral and environmental contributors, like physical inactivity, excessive alcohol, tobacco use, and poor nutrition, drive most preventable cases. But prevention works. Lifestyle changes can dramatically lower risk. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly, at least 150 minutes a week. Quit smoking, limit alcohol, and manage stress. Early screening for high blood pressure, cholesterol, and diabetes is crucial. Medications, when needed, combined with these changes, save lives. Policies like tobacco control, reducing salt in foods, and cleaner air also make a big difference at the population level. In summary, Heart disease encompasses many conditions affecting the heart and blood vessels, from coronary artery disease and heart failure to arrhythmias and congenital defects. It's claiming around 20 million lives a year globally, with numbers projected to rise unless we act. Yet most of this is preventable. Through personal choices, better healthcare access, and global policies, we can turn the tide. In our next video, we're going to be talking about the common symptoms, cure, and how to prevent heart disease. Stay tuned and don't go nowhere. If you want more educational videos on how to live healthy and prevent illness, don't forget to hit the subscribe button and turn on our notifications. See you in our next video.